Olivia Munn bringing a lot of attention this week to breast cancer risk, speaking about her own diagnosis and treatment. So what should women know when it comes to getting assessed for the risk? Here to tell us more about this is Dr. Dipti Gupta, who helps lead Russia's breast cancer diagnostic efforts. Thank you so much for being here.
Thank you for having me, Tia.
Let's jump right into it. So Munn has said she was diagnosed not too long after just a simple mammogram. How common is that?
Well, I want to start with the most important thing, which is that we know that most lives are saved when we start screening mammography beginning at age 40 and continue screening once a year while the woman is in good health. That is for all women because we're all at risk for breast cancer. However, there's a subset of women where we need to do more. And the way that we find these women is by doing a cancer risk assessment. It's recommended that all women undergo risk assessment by age 25, and that's especially true for Black women and women with Ashkenazi Jewish descent. So we can really find women that need exams in addition to a screening mammogram, because our goal is to find cancers early. Early detection really is the key to saving lives.
You were talking about some of those women that need to get those assessments a little bit more frequently, probably, and a little bit sooner as well. What are the factors that could put a woman at higher risk of breast cancer?
Great question, Tia. So the cancer risk assessment tools that we use a variety of questions taken from a woman's medical history, reproductive history, and family history to calculate her chances of getting breast cancer. Different things that can increase our lifetime risk include having a family history of breast cancer, having a personal history of breast cancer, something as simple as just having dense breast tissue, right? So that's why we need a mathematical tool, which are these breast cancer risk assessment models that tell a woman her individual risk of developing breast cancer. And that's how we really tailor personalized breast cancer risk assessment.
You know, we hear more frequently now that breast cancer does not have to mean that it's a fatal diagnosis. Talk about why it's so important for people to find out early if they indeed do have breast cancer, why early detection is key.
You know, absolutely. So, the smaller the cancer that we find, the more likely it is to not have spread anywhere, to be node negative, to be early stage. And that's when cancer treatment is the most effective. And really, we need the least aggressive treatment the lower the stage of the breast cancer we find. So that's why early detection is really our goal.
All right. Well, Dr. Gupta, we appreciate you lending your expertise today. Thank you so much for taking time out to be with us.